Does imaging and scans, do they give a doctor or a radiologist an idea of a problem that has not happened yet? Can you see things beforehand on the scans?
Yes, of course, of course. These scans are so clever and uh, they give all the information actually.
Okay.
So for example, if somebody comes with tummy pain, abdominal pain and discomfort, we will find everything because the information is there. And as a radiologist, my job is to mention each and everything.
Yeah.
And sometimes we find a lot of things which are not relevant to that particular time.
Yeah.
For example, I'll give you one example. Like in trauma patient, we sometimes end up detecting cancer for the first time. Oh. And that can be life changing. And in a way, that was the blessing in disguise, that the patient had trauma and they had a scan and the cancer was diagnosed early.
Yeah.
Same, we were looking at the COVID time. Like it was very interesting times because we ourselves learned a lot.
Yeah.
Because it was something which was unprecedented. And when we were scanning for the lungs, we were fine. Some patients were coming and they had, for example, kidney stone type presentation. And we were seeing that in the lung basis, they had COVID. So that was the first presentation of COVID. That was even before February 2020 when the COVID was just starting. And as a way, at that time, I was a radiologist reporting in radiology in NHS. And I was seeing the incidence of COVID, how bad it was in the community. So all of that was immediately telling us that what's happening in the society. So it does give us all the information, and it's our duty to inform everything, which we do. And then the doctors who are looking after the patient, they will put that in the clinical context.
Okay.
So,
and how often does it happen that when a patient is sent to you for a scan and for, let's say, ABC, but you found XYZ as well? How often does that happen?
Very often.
Yeah?
Very often.
Okay.
So it's like, I would not say that most of the time the clinical question is our priority to answer.
Yeah.
But at the same time, as I mentioned already, that it's our duty to report everything what is there on the scan.
Okay.
So there are two types of changes in the body. One which happen because of our age, one which could be like normal variant, like we all are not made same inside. So they are called just general normal variation from one person to another. That's fine, they are acceptable. We usually tend to describe them and tend to play them down. But if something which is unusual, we mention that, and that's quite common. Like around 50% of the cases, we do something or the additional.
Wow.
And not necessarily they would be needing treatment, but it will be good to know them.
Good to know,
Good to know them, so that in future, either if changes into something, you can act on them, or it can be picked early. I'll give you one example, like gallstones. Everybody knows gallstones, so gallbladder stones. They are so common that a lot of patients who do not have any symptoms, but whenever we do ultrasound of the abdomen, we find them. And not necessarily that the patient has to have an operation or anything, but just in case in future, if they get any symptoms or any attack of gallbladder related pain,
patient and doctor
they know
that this is there.
This is the likelihood.
Okay.
Yeah.